Good afternoon and welcome to this live webinar. I'm Andrew Naprotic and this is the second webinar in the Impact series brought to you by Practice Advisors 360. This series will cover COVID-19 related topics which are impacting the businesses of healthcare practitioners today. These webinars will be short, insightful and purposeful and will provide meaningful information relative to today's COVID-19 economic environment. This particular webinar will focus on compliance for medical practitioners as it relates to COVID-19. It will run for 10 minutes with 5 minutes of additional time for questions and answers at the end. It will cover where your compliance focus should be and how the hornet's nest of compliance can be simplified. I'm excited to be joined by Danielle McKinley. Danielle is the founder of the Hipaa Chick and is one of the founding members of PCIHIPAA. With over 10 years of experience in risk management, focusing on HIPAA, PCI, and cybersecurity, Danielle has a passion for all things HIPAA related, specifically focusing on removing compliance barriers. Danielle, welcome to this webinar. Let's start with the vulnerabilities you see today.
Sure. Thanks so much for having me, Andrew, and hello, everyone. I'm grateful to be here today. We want to talk about how Office Safe can prepare, protect, and prevent any additional issues beyond what we're already experiencing with the pandemic. If this has taught us anything, it's that disasters happen. So we want to help you understand the top vulnerabilities that you should be aware of today and how to address them. So with that, the top 3 vulnerabilities that you should be thinking of as they relate to COVID-19 and coming back to work are remote access, staff training and documentation, and cyber insurance. Now you're probably thinking, where is OSHA? Where is OSHA on this list? And I want to reinforce that these are meant to be 10 minutes and we want to get you all the information that you can, which is why we are doing a second segment specifically around OSHA compliance. Now, real quick on that, there haven't been any new releases. So as you receive information from your national organizations, your state organizations, follow best practice and what works for you, and we'll be coming back soon with an update on the formal rollout and anything that you need to be aware of. Until then, let's talk about the 3 things that are a requirement and you need to be aware of right now. The first one is remote access. So many practices are planning to utilize remote access still as they begin to come back to work. And the reason for this is that to adhere to social distancing requirements, they're looking to keep non-essential employees working from home. So someone in your office staff maybe to work with appointments and rescheduling. And as this happened to us, most of us weren't prepared. And when we went to remote access, we went from a protected environment that our IT provider was securing for us to 5, several, 3, who knows how many unprotected environments. And what I mean by that is the home environment of yourself and your employees isn't protected by your IT. They're not managing the malware or the software updates or making sure that the Wi-Fi manufacturer passwords have been updated. So if you're a practice that plans to utilize remote access as you begin to phase back to work, what you're seeing on the presentation today is a checklist of everything that you want to make sure is happening in addition to the secure login your IT provider has given you. So to access this checklist, you can find it on Practice Advisors 360's site. And the other thing that you want to think about for remote access that many practices we've talked to recently haven't been aware of is you must have a remote access policy. So if you need help with that, that's another thing that we can address for you. Now, the second thing that we want to be talking about is staff training. So staff training is extremely critical even before the pandemic and coronavirus happened, because 90% of data breaches and patient complaints come from humans. They come from your staff because we aren't perfect. So the only way to protect yourself from the massive penalties that you read about in the media are by having the proper staff training requirements. So what I'm showing you here is a training tool. It's inside of our technology called Office Safe. And there's 3 main things that you need to have to be compliant under training. The first one is content. you have to be able to reproduce your content to prove that it is current, it's up to date, and we are an accredited organization, so we guarantee that the training material through this program meets the standards. The second thing that you need to have in some way is accountability. You have to be able to show that you made sure your team understood this information, because let's face it, HIPAA is not exciting. Now, the final piece, and this is crucial because this final piece I'm about to show you, this is what protects you when human error is the cause. And it's having a list of your team members and being able to prove that they signed off on the proper acknowledgement forms, and there's 2 of them. You also need a tracking mechanism. So OfficeSafe has automated that process to ensure that everything you need to train your employees is in one place and is simple. The other big missing part of training that a lot of practices don't think of is typically when we speak with practices, they have an annual training where they send the staff out somewhere or they have someone come in. The downside to that is that if you have turnover or you hire new team members and you're waiting until that next training date to come around, if they make a mistake between their hire date and that next annual training, you can't prove that team member was trained. So you'll be hit with massive penalties for non-compliance. So this shores up that gap for you so that you always have access to the training material. Now, as we talked about OSHA coming in the next segment, that's also going to be here in OfficeSafe, where we will walk you through the online portion of OSHA, which is really important because we're trying to limit the amount of people that are coming into the office, right? So being able to train online is a huge need in the marketplace right now that we are happy to be able to solve. So we'll get back to that when you return for another segment on OSHA. Now, getting back to the top 3 vulnerabilities, the third one is going to be around cyber insurance. And cyber insurance is by far the most likely to be used policy that you have. And the reason is that due to the pandemic, data breaches and phishing scams and ransomware activity is through the roof. It is growing exponentially, and hackers are always going to be 10 steps ahead of us. There's no way to stop them. The only thing that we can do is put ourselves in a proactive position so that if they get us, we can quickly respond and minimize the impact that has to our business. So cyber insurance helps you from a financial standpoint, right? Now, let's talk about the 2 biggest misconceptions. General liability and malpractice insurance do not come with cyber and data breach insurance. There are some vendors who have started to add a small rider policy, usually between $50,000 and $100,000, and they'll throw that in, or if you ask them about it, they'll give you a statement credit of usually $80 to remove it. That is not enough coverage for your practice. So that's misconception number 1. Misconception number 2 is I have $1 million standalone cyber insurance policy that's going to protect me. False. What do insurance companies always try to do? Think about it. They try not to pay. They try to limit the amount that they pay. So you want to make sure that how can they deny your claim? What does that policy look like? And how they typically deny claims is they will request proof of compliance. If you can't prove that, your claim is denied. So what you're seeing on the presentation here is a breakdown of the breach notification steps you're required to follow. So when a data breach happens, you have to report the incident. How we help you with that is right here in OfficeSafe, this reporting feature. You document what took place. You have to keep this on record for a minimum of 6 years. If we determine that a breach happened, the remaining steps that you see on the screen here then kick in. You have to do a forensics investigation. You have to notify each patient formally in writing. You have to set up a call center for a minimum of 60 days. And you have to provide and pay for identity theft monitoring and insurance for a minimum of 1 year. And that's just to name a few. So to clean up an actual data breach or to respond to a ransomware attack and get your systems back up and running, the average cost is $200,000 to $250,000. That's not what we read about in the media. What we read about in the media is much higher. And the reason it's much higher is because there are penalties put on on those practices in addition to the cleanup expense because they're not compliant. So step one, get prepared. Step two, get protected by being compliant. And step three, be in a position to prevent losses using cyber insurance. So there's tools and resources you can get access to as a follow-up to today's presentation. If you don't know what your insurance is, or if you don't have insurance, let's help you understand it. With our program, we give you a $500,000 insurance policy, and the thing you should be looking at on the screen is the word guarantee. So as we talked about earlier, that insurance companies try not to pay, our program has been underwritten by Lloyd's of London, and therefore we guarantee coverage for our customers that are on our compliance platform, Office Safe. So for the last vulnerability, cyber insurance, at a bare minimum, make sure you understand your coverage. If you have questions about your insurance, or you're unsure, or you don't have any, please reach out to me. I am more than happy to help you understand what you've got and to make sure you are adequately covered for a data breach, a ransomware attack, an audit, or an investigation.
Thanks, Danielle. I'm researching my insurance policy as we speak. Some very interesting facts to worry about and research. Very insightful. Thank you. During your short presentation there, we received several questions from different locations. Let me start with the first. The first is from Ravi in Colorado. Ravi asks, I heard you surveyed practices about COVID-19. How many practices did you survey and what did you learn?
Sure. So we surveyed thousands of practices and we got over 1,500 responses. And some of the biggest things that we learned are the top 3 vulnerabilities that we talked about today, and that practices really don't have a resource for them. Practices feel very lost because, as I mentioned, they're getting inundated with information, inundated with webinars, inundated with emails, and they just want someone to tell them, what do I need to do to be protected and to get reopened? And they want to understand that in regards to staff training, utilizing telehealth, remote access, what to do with like business associates, and also that what are the needs around contactless payments. And then of course, PPE. PPE is a big one in finding sourcing for that. So that's something that we're also hoping to add to our resource center that, Andrew, I know you're going to share with the listeners soon.
Thanks for that. The second question is from Craig in Boston. It's in relation to business associate agreements. He's wondering who the sender should be.
Sure. So business associate agreements is one of my favorite parts of the law because it's actually designed to protect the covered entity and the practice, because your third-party vendors like your IT company, your practice management software, you can't control what they're doing. And they're accessing sensitive information from your practice, or they could. So that's what makes them a business associate. Now, you should be the sender. Okay, you need to send the agreement. Think of it like the sender of the agreement is the protected party. So if one of your vendors has an incident like a ransomware attack and that affects your practice, the only way to protect yourself from penalties is by being able to prove you have a current agreement, it's customized for that vendor, when you sent it, whether they signed it, or if in lieu, they sent you a copy of their agreement. But if they're sending you a copy, or if that's all you have for your practice, definitely connect with us because you need your own agreement and you need to be the sender.
Thanks, Danielle. We have time for one more question. It's from Steve from New York. His question is, how do I identify my practice's vulnerabilities?
Sure, great question, Steve. So one of the easiest ways to get started and understand the scope of your compliance status is a risk assessment. And a risk assessment is actually required to be conducted each year. The purpose of it is to help you understand any changes to the law. It works like, the easiest way to describe it honestly is no one teaches us how to file our taxes in school, and no one has taught any of you how to navigate the HIPAA laws. So the purpose behind the risk assessment requirement is to provide a resource to understand where you're at, what you need, and how to get there. So a risk assessment, by far the best next step for your office, Steve, and we have a free risk assessment tool that you get complimentary because of our partnership with practice advisors. So that'll be a part of the resource center that Andrew, I think, is about to share.
Great, thank you there, Danielle. Unfortunately, that's it with the questions. That's all we have time for. We'll be making all the questions and answers available on the Practice Advisors 360 website. Before going through the contacts, Danielle, if you can quickly describe how you're helping practices today, because there's some useful information on how individuals can reach you as well.
Yeah, absolutely. So look, everything that we're doing is about spreading good karma. We know that this is a tough time for everyone. All businesses are being severely impacted in one way or another. So we are giving away programs, free tools for 90 days, and even that cyber insurance policy that you saw briefly. We're giving away a risk assessment like Steve had asked about, and you can find those tools on the practiceadvisors360.com site. So go there, subscribe to the Impact series, learn more of the helpful tools, and get access to all of the free resources we've created to help respond to the COVID-19 crisis.
Great, thank you. And as Danielle says, if you haven't done so already, please register for the upcoming webinars on the link provided on this page. This will help ensure that we keep you informed with the upcoming schedule. In addition, you can subscribe to the Practice Advisors 360 YouTube channel. A recording of this webinar will be placed there. In the meantime, if you have questions or require advice, please reach Danielle through the Practice Advisors 360 website using the contact details provided or directly to Danielle as noted on this page. Thank you for your time today, and please stay tuned for information about the third Impact webinar.